Thank you. This is the third and last video in this series. I appreciate your patience, and I'm delighted that you're taking the time to look at this technology. This video is designed to tell you when to do it, when to readjust these animals, and some other information that are unique about doing animal adjusting. Notice that we call the term animal adjusting and not animal chiropractic. The technology basically is delivered just the way you saw it, 3 passes, and that's an adjustment. You charge for that adjustment, and then you tell the client that they need to come back or we need to adjust them again in 7 days. There's a 7-day interval between adjustment 1 and adjustment 2. We adjust them in exactly the same way. Write down the information. We go in Module 2, we show extensively how to put that information into the administration paperwork, essentially, keep track of everything, etc., etc., and also how to set up other types of things in Module 2 and also Module 4. The other thing that we do, too, is we're going to basically adjust them the second time. We want to know if the animal's better and if the animal's showing response. Very commonly, they showed an extensive response within hours of the first adjustment, but a series of adjustments is sometimes necessary to make sure that the animal gets better and stays better. If we just adjust them one time, they'll get better in about 2 or 3 days, and then after about 2 or 3 weeks, they'll come right back to where they started from. So we have to reprogram normal into the spinal cord. That is done through a series of adjustments which have increasing weekly intervals in between them. So we adjust the animal on day 1 with the technology that we've shown you, and then do the same thing 7 days later, which would be day 7, 1-week interval. The next interval that we use is a 2-week interval, and the 2-week interval would be adding 14 days to day 7, which would be day 21. And then after that, we adjust the animal again the exact same way. And after that, we'll go to a 3-week interval, which is day 42. And then after that, a 4-week or 28-day interval, which is going to be day 70. And at that point, very commonly, we don't have to adjust these animals anymore. Very commonly, too, in the first 2 weeks, the animal will be asymptomatic. And the client will say, well, the animal's cured, why should I bring the animal back? Well, the reason is we want to reprogram normal. If we bail out prematurely, the chances are that animal will go for 6 months and come right back to the same problem. This is the problem with manual adjusting, too, because if the listing goes away after the first couple of adjustments, there's nothing left to adjust, and then, of course, 5 or 6 months later, they have the exact same problem again. I'm not trying to criticize manual adjusting, it just doesn't work well enough for me to use in clinical practice. The other thing, too, is that we're working in the field of veterinary medical care, essentially. And so if you're a licensed veterinarian, you don't have a problem. A license in that state, you can do anything you want. You can call it anything you want, essentially. And Dr. Henry technology, you can call it whatever you want. But if you're doing this technology yourself and you're not a licensed veterinarian in that state, or you're a chiropractor that's licensed in that state, or a chiropractor not licensed in that state, or an animal health technician, or somebody else, even if you're somebody that swam across the ocean from Cuba and you're an illegal alien, you can do this technology. You can do it for all your animals and all of your friends' animals, and you can do that for free. But once you start charging for this, the veterinary community and the veterinary powers that be will suggest that you're practicing veterinary medicine and you're not licensed, essentially. And so it requires for you to do what's called veterinary affiliation. Now, veterinary affiliation doesn't mean there's a veterinarian standing right there watching you do this work. That means you're affiliated with a specific case, with a specific veterinarian who's licensed in that area. And I have to tell you that in Module 2, we go through extensive amounts of information on how to work with veterinary affiliates, what to do, what not to do, what say, and how to work with whatever veterinarian you want to work with, essentially, who, by the way, will end up sending you all of your business. You don't have to advertise, which we go over in Module 2, that you don't have to advertise. You don't have to promote. You don't have to even create flyers. You just start doing it, and through word of mouth, you stay as busy as you want to, especially if you do equine. The head of the chiropractic examiners or chiropractic physicians board in the state that I reside in has extensively examined me professionally, legally, and also this technology. Her name is Dr. Shannon Gertner-Ewing, and she's also the representative of the Idaho Chiropractic Physicians Associations to the National Association of Chiropractic Examiners. She has optioned to investigate this technology and essentially has investigated other technologies and chosen not only to okay this in our state and many other states, but also to recommend it to other states over other technologies. And also, she's recommended it enough to the point where she has optioned to become a certified veterinary chiropractor herself. CVCP stands for Certified Veterinary Chiropractor. We're hoping that you will log on to the VOMtech.com website or call me at 888-935-4866 or email me at drbill@vomtech.com and ask more questions about the certification. However, this particular course and how to do it, why to do it, and when to do it essentially is something that you're going to be able to have learned in this short introductory series that we offer for you for free. Now remember, we do this not because we want to sell you a device or a course essentially, because we want you to treat the animals that you're going to treat for the sake of the animals. It's about the animals. And so this technology has saved the lives of hundreds of thousands of animals and tens of millions of dollars of unnecessary veterinary expense in the last 30 years. We're hoping that you'll continue to do this type of technique. You're going to be 91 to 93% successful, and you're going to be tickled to death that you've taken the time to look at this particular technology. Remember, it's about the animals.